Welcome back, everyone. Happy Monday to you. Move better, feel better, live better. That is the motto of our next guest. At Georgia Bone and Joint, doctors are the leading experts in providing exceptional orthopedic care for those in need of hip and knee replacement. Joining us today to tell us all about it, their patients are finding new leases on life is orthopedic surgeon Dr. Michael Gruber and success story Francois Wahlberg. Welcome to you both.
Thank you. Welcome.
Well, thank you for being here. And Francois, we're going to get to your story in just a moment because I think nothing tells the story of feeling better and living the life you want than having a live testimonial here in the studio. But doctor, I want to start with you. Tell us more about Georgia Bone and Joint.
Georgia Bone and Joint is in Noonan, Georgia, and also in Peachtree City. I've got 6 wonderful partners, and we cover really the gamut of orthopedic surgery. We've been in practice as Georgia Bone and Joint for about 18 years.
Wow, fantastic.
And we have Georgia Bone and Joint Surgery Center, which is an ambulatory surgery center for orthopedics. And we do over 3,000 procedures a year at that surgery center.
That's incredible. And I was interested in hearing that these are outpatient. So tell me more about that. I know things have changed so much with technology in being able to get these patients back up on their feet quickly, but
well, things have changed dramatically during my career. When I was a resident, patients would come in the night before surgery.
Sure.
They'd have their surgery, they'd stay a week, they'd have 3 or 4 days in bed, and that was true for total joint replacement. And then things became more accelerated, and then now we're able to offer both hip and knee and actually shoulder replacement as outpatients in our surgery center.
Wow, that is phenomenal. And minimally invasive, right?
Well, we use techniques that do minimize the injury to the tissues, and that's part of what allows us to do this as an outpatient. There's also been tremendous improvements in anesthetic technique that allows us to do this as an outpatient.
That's so wonderful. And I know, again, back in the day, it used to be that you were out of commission for several weeks, maybe from doing the sports you love, several months. Talk about the recovery time now.
Recovery's changed. It's really become more of a sports medicine game. I'm trained as a sports medicine orthopedic surgeon, and really what brought me into that area of orthopedics was the opportunity to get people back in the game.
Yes.
And we could do that quickly. We could do it with accelerated rehabilitation after surgery that tried to minimize trauma. And we brought that same philosophy to joint replacement. And that's what allows us to do these hips and knees as outpatients. And most of our patients go home within 4 or 5 hours of their surgery.
That's unbelievable. And I know we have a video right now of a patient right after surgery. So talk to me about what we're seeing here. He just had surgery.
He did. This gentleman's actually 4 hours out from surgery. He had a regional block. We also use a novel anesthetic inside the joint that basically numbs the joint. And it's difficult to say which hip he had done. I think you're looking at this video, it's rather difficult.
Look at him.
He's doing a little jig for us. Yeah, he's a pretty animated guy.
I think he's just so happy. He has this energy and vitality that he probably had been missing out on for a long time, having that pain.
He had. And you saw him move that right. And that's the giveaway we did, his right hip replacement.
Yeah. And then we have another patient now. Let's roll that video. 3 days later?
This is the same patient.
Oh, sorry, same patient.
Same patient. 3 days later. And he's, again, it's rather difficult to say which hip we replaced.
Look at that. He is just absolutely elated. And Francois, does this look like the way that you were acting after your surgery? Tell me what led you to Georgia Bone and Joint.
Yes. So I started to lose my mobility and flexibility. And I tried everything. I did through physical therapy, cortisone shots, and then I started to investigate what was the best for me, and led to sports medicine because I was focused on the recovery, not on the surgery itself.
Exactly.
And I found Dr. Gruber and his team close to home. And when I met Mr. Gruber the first time, I thought that was the right guy for me.
Yeah.
And I just did it.
Good. Now, what part was bothering you? Was it your hip, your knees, shoulder?
So I could not walk anymore for 3 months. I was paralyzed.
No.
And I could not put a step in front of each other. So I did the first hip end of October, and the second one mid-December, 6 weeks after, back to back.
Wow. And talk to me about the recovery process. We're looking at pictures of you. You had the walker for a while, I imagine, but oh, there's your children?
Yes.
So cute. What was it like for you getting back on your feet?
So as soon as you wake up from the surgery, you feel like $1 million. And then 2 hours after, you start walking with the walker. And then 1 week after, you take the cane. And 2 weeks after, you're back to walking approximately normally. And then 3 months after, I'm recovered.
Are you? Are you back to your full, healthy lifestyle, doing the things that you love?
Yeah, I travel in the US. I go to India next week for 2 weeks. I play golf.
Oh,
So it's all good.
that's amazing.
Yes.
We're looking at pictures there. There you are, sightseeing, which, you know, that's always difficult to do when you're, you know, unable to walk or live the life that you want to
Yes.
live. And doctor, are these results pretty typical?
They can be in these type patients. You know, obviously patients are vary tremendously in their physical abilities
Yeah.
and what it means to them to get back in the game. Sometimes it's getting back to golf. Sometimes
Sure.
it's being able to go see your grandkids. So
Right.
it varies tremendously.
And what kind of patients are you looking for? If somebody's watching right now and has some issues, as you mentioned, shoulder, hips, knees, you know, what are the questions that they should be asking to lead them to you?
Well, most people, when they come to me and tell me that they need a joint replacement, it's really based on the effect on their lifestyle. The osteoarthritis has become such that they can't go see their grandkids. They can't go for the walk in the neighborhood. And so they come to us with the question, can this be fixed? And it can. And hip replacement and knee replacement have changed tremendously in the last 10 years. The components are better. The wear characteristics are better. So whereas when I first started my career, and really the joint replacements weren't going to last more than 7 or 10 years, we had people go to the point they were walking on a walker, that they really couldn't get around. But now it's when it affects your lifestyle. It's time to come in and have it done. And you may have a hip that's going to last your lifetime.
That is incredible. Well, we're living longer, we're more active, and you know, we want to feel like ourselves, keep up with our families, and it sounds like you're doing just that now. So congratulations.
Thank you.
That's good news. Thank you so much, doctor. Appreciate your time. Ooh, and once again, make sure everyone knows where you're located and how to find you.
Georgia Bone and Joint, we're in Noonan and Peachtree City.
Good.
Our website is georgiaboneandjoint.org or .com. That works fine as well.
Excellent. Thank you both.
Thank
So
you.
appreciate it. Well, Francois has no regrets. Are you looking for relief as well from a well-trained, friendly staff? Then look no further. Call today. It's 770-502-2175 or visit the website, as the doctor just mentioned. It's georgiaboneandjoint.org. Thank you both. Great information. Suffer no more, right?
Right.